Brian, this is Sam. Can you hear me? Copy. Gavel. What? I'm going to call the Finance Committee meeting of the Health System to order. Apologize for starting a few minutes late. Will the Secretary please call the roll?
Present.
Present. Ryder is here. Welcome, Chairman Garza. Usually I just go like this, so. Are there any directors that are joining virtually? I waited until she got up away from her. Okay. So we do have a quorum. The next regular meeting of the Finance Committee is scheduled for Thursday, March 5th at 10 a.m. Deb, do we have any public testimony?
Alexander.
All right.
And as a reminder, you have 3 minutes. I'll give you a heads up when you've got a minute and then 10 seconds remaining.
Good morning. My name is Adrienne Alexander. I'm here with members of AFSCME. I'm their Director of Intergovernmental Affairs. I'm here, unfortunately, to address another example of a pattern of subcontracting without regard to our union contract. I'm referring to the Chicago Lighthouse contract, originally on the agenda for an extension. AFSCME represents roughly 30 to 33 employees working in the CCH call center, handling anywhere from between 3,000 to 4,000 calls per day. On any given day, the 10 to 15 employees from Chicago Lighthouse handles an average of 600 to 1,000 calls a day. The union views this as an erosion of the bargaining unit work because they are handling calls during our work hours, and county employees have not been offered overtime opportunities. On January 16th, the union received notice of an extension of the current contract, and it is our position per our collective bargaining agreement that this notice should have been received 5 months ago. We have asked for information regarding alternatives to subcontracting and cost comparisons for the expenses the employer projects if they use bargaining work employees versus a third-party vendor, and have not received any of this information. They have not shown us in any supporting information that subcontracting would be more efficient. As we were discussing concerns with the vendor with members, we also found another instance of a different contract where, once again, in direct contradiction with the CBA, we were never given notice of a contractor doing bargaining unit work. As I said, a pattern. We recently won an arbitration over a similar issue, and the Cook County Board has continually expressed their desire to see the system bring more work in-house. So I am here asking once again that in your capacity as the board, you hold management's feet to the fire to both respect our contract, the will of our electeds, and what's best for taxpayers by doing your due diligence on these contracts, particularly the Chicago Lighthouse contract that was before you. Thank you.
Thank you. As I think we've noted that this contract is not on the agenda today, though it originally was. It's been pulled so that internal discussions with staff and leadership can happen to then re-engage with the union to hopefully get us on a path before it gets presented again. And we will certainly engage with the union here after we have some internal discussions. Are there any other anyone else?
Nobody else.
Okay, all right. That concludes public comment. So we are going to move to our next item on the agenda, which is the January 8th, 2026 Finance Committee meeting minutes. These were approved at the January board meeting, but are being presented for the committee's review and discussion if necessary. Are there any corrections needed to be made to the minutes? Any corrections to the minutes? Any corrections to the minutes? Hearing none. Is there a motion to accept item 3A, the January 8th, 2026 Finance Committee meeting minutes?
So moved.
A motion's been made. Is there a second? Second. Motion's been made and properly seconded. Any discussion on the motion? Hearing none. All those in favor signify by saying aye.
Aye.
Opposed? The ayes have it. We are now going to move to the to items under the Chief Procurement Officer. First is the contracts and procurement items. I believe we have a healthy amount, a total of 31. Again, noting that item number 18, Chicago Lighthouse, was withdrawn and will be revisited at some future point. First up is, well, first I'm going to go to Charles Jones, our Chief Procurement Officer.
Yep, thank you. Good morning, Charles Jones, Chief Procurement Officer for Cook County Health. So with the withdrawal of request number 18, 28 of the 31 items before you require responsive letters from the Office of Contract Compliance. We have 24 back with 4 in progress. Turn back over to you, Chair Wright.
Right. So first we have request number 1 through 3 being presented by Aaron Gleaner, Chief Administrative Officer of Health Plan Services. Aaron?
Thank you, Chair. Good morning, directors, or good afternoon almost. The first item before you is a amendment to a contract with vendor Cobblestone, $190,000. This relates to a changes for our provider data management systems that ensure that we are in compliance with state and federal requirements related to provider data in our provider directory. The second item is a one-year extension request. This is the first annual renewal under this contract, which was awarded through an RFP process for actuarial services, $2.3 million with vendor Milliman. Then the third item is a new contract, result of an RFP for a 3-year contract total of $2.2 million. Vendors One Up Health, and this is to provide interoperability requirements which relate to data that we're required to share with members across a variety of different sources to comply with the federal patient access rule. Thank you.
Great. Thank you, Aaron. Next up are items number 4 through 6, being Cook County Department of Health, being presented by Dr. Kiran Joshi, our Chief Operating Officer for the Health Department.
I think I'm stepping in for Kieran today. So you've got Marley Hendricks here, Director of Public Health Administration. Hello, everyone. So this first contract in front of you is a request to increase an existing contract for mosquito abatement services with Clark Environmental. The amount not to exceed $154,171 through June of this year. Any questions on this one?
Are there any questions?
Great, thank you. This next one is a request to extend an existing contract for lead remediation services under our lead hazard grant. It's a reduction in value of $173,750. And this runs through this fiscal year, was reduction running through November of 2025. Any questions on this one?
There are no questions. Go ahead and move to request number 6.
Thank you. And this last one is a request to execute a contract for technical assistance for a health impact assessment tool and toolkit development, not to exceed the value of $358,000 through February of 2027.
Are there any questions on request number 6? All right, thank you.
Thank you.
We're now going to move to request number 7, behavioral health, being presented by Jennifer Brothers, Executive Director of the Impact West Community Services. Morning, afternoon. Morning.
Happy New Year. I am here to request an amendment increase for Sage Health Strategy for $425,000 to increase the build out of our Cook County Behavioral Health Apprenticeship and Retention Hub, and including the development and pilot of a pre-apprenticeship program and the build out of the apprenticeship program for early pathways into behavioral health.
All right. Mr. Chairman?
Yeah, a lot of technical language there. Can you break that out a little bit more?
Sure.
Yeah, thank you.
Yeah. So we conducted with Sage and Trailhead Strategies a behavioral health workforce assessment. When ARPA came along with the increase in funding, we, for the longest time in behavioral health, we haven't had the workforce and we haven't had the funding. And then we got the funding, and it shined a huge light on the need for workforce. You know, everything from our case managers, our certified alcohol and drug counselors, our social workers, to our psychiatrists. We just don't have enough. So we could put all the money into the system, but everybody's clamoring for the same social worker and psychiatrist, right? And so we are trying to figure out ways. So we did this assessment. We held a workforce symposium last October where we kind of rolled out these key recommendations. So now we know there's a workforce. It's not anecdotal. We have the numbers as to what the shortages are. How are we going to address this workforce shortage? And we laid out clear recommendations on how we build a more robust, resilient, and representative workforce. Part of that is creating a pre-apprenticeship program. So, you know, it's how do you go for a career how do you look into a career that you don't know exists, right? So how do we build out that? Then there's the early entry pathways to behavioral health. So we think about our certified alcohol and drug counselors, our peer recovery support specialists, our case managers. And so we secured funding, the workforce assessment was done 2 years ago. We secured initial funding through DCO grant to kind of build this kind of apprenticeship early pathway program. And we actually launched our first cohort of apprentices working with Job Forward and Sage and Trailhead Strategy this month, in fact. And so we want to continue that kind of build out and working with local colleges and universities and community behavioral health providers to build up an apprenticeship, to build a pathway for those early entry behavioral health roles.
How long is a cohort experience?
Every cohort's different. So this first cohort will be for a few months, and we're with Kennedy King College and Governor State and Haymarket to kind of put our first cohorts of CAD, certified alcohol and drug counselors and peer recovery support specialists.
Thank you. Very comprehensive overview. Thanks.
Thanks.
Any other questions? Hearing none, thank you. We're going to now move along to request number 8, being presented by Dr. Daniel McCormick, our Executive Chief Clinical Officer.
Good morning, afternoon, directors, 10 to 12.
Dr. Mikaitis has made a ruling that it is still morning.
So I'm here to present a contract, an execute contract for Prescani Associates. This contract is in the amount not to exceed $8,330,807 for a 60-month period from April 1st, 26th through March 30th of 2031. This is our software platform for everything: patient experience, quality, risk, peer review, et cetera. It's all one platform and the consolidation of 2 existing contracts.
Any questions? None. Thank you, Doctor. We're now going to move to request number 9 through 13, being presented by Dr. Lawrence Smith, our Chief Medical Officer. Good morning.
Directors.
Good morning.
I noted the morning. So the first contract is an execute contract with Polynova North America. This is a product that will be used in our trauma and burn patients, and it actually offers a cost reduction as well as better outcomes for our patients, not to exceed the amount of $1,202,400 for a 36-month period ending February 28th, 2029. The next is an execute contract with BK Medical Holding Company. This is a GPO. This is a capital purchase as well as a service plan for products that will be used with our neurosurgery and urology departments, not to exceed the amount of $725,251.10 for a 48-month period that includes the service plan.
Go ahead.
Next is an execute contract with Glaukos Corporation. This is for products that are used in our ophthalmology division, not to exceed the amount of $468,750 for a 36-month period ending February 28, 2029. Next is an execute contract with Boston Scientific. This is for supplies that will be used in our cardiology division, not to exceed the amount of $300,000 for a 36-month period ending February 28, 2029. Next is an execute contract with Medtronic. This is for patients in our vascular division, not to exceed the amount of $188,900 for a 36-month period ending February 28, 2029. Next is an execute contract with Patterson Companies. These are for supplies for oral health throughout our ACHN network, not to exceed the amount of $2.5 million for a 36-month period ending February 28, 2029.
Correct. Any questions? All right, thank you. We're now going to move to request number 15 through 16, corporate compliance, being presented by Nicole Almiro. Did I say that right? Yeah. All right.
I think any pronunciation, anything's fine.
Anything works.
Yeah.
Anything works. Our Chief Corporate Compliance and Privacy Officer.
Good morning. I'm here to kindly request an extended increase for two contracts. Both are firms provide compliance consulting services for the compliance office. The first is Bassberry and Sims for $93,000. And the next one is Health Law Consultancy, LLC, for $75,000.
Any questions? All right, thanks, Nicole.
Thank you.
All right, we're going to move on to request number 17, Equity and Inclusion, being presented by Shannon Andrews, our Chief Equity and Inclusion Officer.
Good morning. The item in front of you is a request to extend and increase the contract with CCH International Corporation. The increase not to exceed $70,500. The extension will take us through January of 2027. This is a web-based contract management system that's utilized across the system in order to manage the contracting process.
Any questions? Hearing none, thank you. Next up is request number 19, Health Information Services, being presented by Angela O'Banion, our Chief Information Officer.
Hello. The contract before you is to execute a contract for Fortified, doing business as Fortified Health Security. While this is a new contract, Fortified has been doing business with us at Cook County Health under the Oracle contract originally in 2019-2020, when we did not have a Chief Information Security Officer. They served as our virtual Chief Information Security Officer. They helped to set the framework for the renowned NIST framework standards, which has improved our cybersecurity and third-party risk management scores from the 60s to the 90s over the last several years. The reason this is sole source is we are pulling many of our, almost all of our contracts from under the Cerner Oracle contract in order that we may have better management and controls of our third-party vendors.
All right, any questions for Angela? Hearing none, thank you, Angela. All right, next up is request number 20, Human Resources, being presented by R.J. Dabney, Associate Chief Human Resources Officer, who's presenting remotely.
Good morning. Thank you. This request, this request is to extend and increase the contract with Kirby Bates, who provides interim search for various leadership positions. Our request is to increase and extend the contract for 12 months from March 1st, 2026 through February 28th, 2027, in the amount not to exceed $900,000.
All right, any questions? Hearing none, we're going to move on to request number 21 and 22, being presented by Elizabeth Vaglavic, our Interim Chief Nursing Executive.
Thank you.
Thank you.
So the first one, I'm asking for an increase in the contract for VIA in the sum of $11.5 million. This is for the agency nurses.
Right. Any questions on this one?
Okay. My second contract is, I'm seeking contract approval for Synthes uniforms for the nursing staff. This contract will go from 2026 to 2031. It will provide uniforms for our nursing staff, a standardized uniform that will be rolled out to all of our nurses and be prepared for the additional new hires that we have over the year.
Any questions on this one? All right. Thank you.
All right, thank you.
Next up, go Seahawks. Request number. Are you doing request number 27 too, Craig, or is Lauren doing that one?
Yes, I am.
Okay, so request number 23 through 27, being presented by Craig Williams, our Executive Chief Operating Officer, and hey, I don't know what to say.
They made it there.
Yeah.
Wait, that was big. Be careful, be careful. Oh, they don't play in the NFC, so it's okay to say that. Good afternoon. The first contract I have is for Interstate Electronics Company. This is an extend contract with no fiscal impact. We're asking for 12-month contract extension, 5/1/26 to 4/30/27. And this is related to our nurse call and overhead paging systems at Stroger. And this company provides maintenance and repair as needed on those systems. This is a sole source because the vendor is the only authorized agent to provide this maintenance. Hillrom is an increased contract for $150,000 through the remainder of the contract period, 3/31/27. And this is to provide parts and labor to maintain 240 Hillrom beds at Stroger, which will keep us in compliance and reduce our overall capital need for beds. Johnson Controls is an execute contract for $9,996,885. 36-month contract, 3/1/26 through 2/28/29. And JCI provides testing, maintenance, and repair services for our security systems, the building automation systems, our two-way radio systems, as well as electrical distribution equipment. The next is Devacor Medical Products. It's an execute contract for $289,300. 36-month contract, 3/1/26 through 2/28/29. And this is related to a Mammotome Revolve and Confirm systems, and this provides supplies as well as a 3-year service agreement. This is a sole source. The equipment is highly specialized, and replacement parts is exclusive to this vendor. And this vendor is a former GPO vendor. And the last one is a shared one with Dr. Smith. It's for Emergis locum tenens staffing. It's an extended increased contract for $5 million. 12-month contract extension, 2/15/26 to 2/14/27. And this is for the continued provision of locum tenens staffs across the departments of anesthesia, pain management, psychiatry, and ambulatory services. We're actually, an RFP has been posted for this service.
Any questions on any of the items? Hearing none, thank you, Craig. We're going to move to request number 28, Provident Hospital, being presented by Dr. Turner, Provident Hospital Chief Hospital Executive.
Good afternoon, directors. This is the request to execute contract with.
Ooh, right call. We did make it to the afternoon.
Been watching the clock. This is a request to execute contract with Siemens Medical Solutions USA in the amount of $1,537,862. The GOP source contract. The vendor will provide a new Magneton Viatomobile MRI system, new trailer, software, accessories, installation, and full turnkey solution. The installation and full turnkey project will be funded by lease line of credit. This will expand our access for MRI services at Providence Hospital and allow us to retain more patients at Providence.
All right, any questions? Hearing none, thank you, Dr. Turner. Next up, our request number 29 through 31 being presented by Danica Austin Cathy, the Chief Hospital Executive for Stroger Hospital.
Thank you, Chair. Good afternoon, everyone.
Good afternoon.
All right, the first is an increased contract with Morrison Management Specialists. This is for the culinary managerial services, food and food distribution for both Stroger and Providence in the amount not to exceed $16,071,793. Contract period 10/1/2022 through 30/2027. This request is for the continued provision of the management services, supplies, software, food, and food distribution to Stroger and Providence. The next is an extend and increase contract with Denver Solutions. This is for the clinical supplies, compounded sterile preparation of critical medicine in the amount not to exceed $365,000. The revised contract period 3/1/2026 through 2/28/2027. The vendor will continue to provide compounded sterile preparations of vancomycin, mitomycin, and moxifloxacin to meet the critical pharmaceutical needs of the healthcare facility. And next, we have an extend and increased contract with Humatic. This is for the patient queuing systems, annual software maintenance and supplies for the pharmacy equipment, and the amount not to exceed $50,000. The revised contract period 2/1/2026 through 1/31/2027. This is a sole source. The vendor will provide patient queuing systems with annual software maintenance, Care Plus hardware maintenance, and supplies for the equipment. The request is a sole source because the equipment is used for all of the Cook County Health pharmacies.
Any questions? Hearing none, thank you, Danica. And then our last one, we're bringing back to the plate our, better to make a baseball analogy, Craig Williams, our Chief Operating Officer.
Hi, this is an expenditure request for Pamela Denise Smith. Dr. Smith had been a CCH staff member. We contracted with her to come back and provide services to first the Migrant Health Clinic, and then she also provided coverage across primary care at 2 sites. She had a contract that expired 2/28/24. And I think that there was, on my team, there was a gap in realizing that contract expired. We put a new contract request in July of 2025, which never got executed. And so we do owe this provider this amount, $223,500. I'm requesting that expenditure. We've put her work on hold until we get a new contract in place for her services. She's been a really good player for ACH and our primary care team, so we would like to develop a new contract, but obviously need to get this expenditure resolved.
Any questions on this one? Hearing none, thank you. All right, Charles, before we take up a motion, anything else?
No, sir.
Is there a motion to approve item 4A, contract procurement items containing request numbers 1 through 32, with the exception of request number 18, which was withdrawn, and subject to complete review by contract compliance? So moved. Motion's been made. Is there a second? Second. Motion's been made and properly seconded. Any discussion on the motion? Hearing none. All those in favor signify by saying aye. Aye. Opposed? The ayes have it. Now we're going to go to our fiscal 24 Q4 fiscal year 2025 support contracts executed under the authority of the CEO. Charles?
Right, thank you. So before you have contracts for the Q4 of 2025, September, October, November. There was 15 total there. All 15 were responsive for MBE, WBE participation with the Office of Contract Compliance. 4 of them are GPO vendors and 5 capital equipment purchases as we continue to, at that time, buy down capital equipment for FY 2025. Just highlighting for you some of, they're in alphabetical order, so just highlighting some of the larger dollar purchases. The BioRare laboratory was for Genesis HIV, first and second supplemental assays system and consumables on behalf of the Department of Laboratory, $139,000. Evron LLC, we bought a monitoring system for the HCHN clinics with, this is health plan, this is preventative maintenance service there, $132,000. HMA provided public health policy and plan landscape analysis there, $144,000. Contract with Secure Tech 360 LLC. This gave us employment screening and reference check on behalf of the Department of HR for $120,000. And then highlight Studio AH LLC. They did roof debits and tapbacks for the Providence Hospital roof capital project there, $145,000. Any questions on what you see before you?
Any questions for Charles? Hearing none, we're going to, we have emergency purchases?
No, sir.
Oh, we got.
All right.
Oh, yeah, not being presented. Then we're going to move to items under the Chief Financial Officer. Thank you, Charles.
Thank you.
First up are receive and file grant award related items, and we have our interim CFO, Scott Spencer, coming to the plate. Scott, stuck on these baseball analogies.
All right. Thank you, Chairman. Good afternoon, we are officially afternoon now.
Mm-hmm.
Good afternoon, directors. So starting with the receive and file report, we have 5 items here. All executive sponsored by Mark Spranka, and the largest item is the bottom row there, City of Chicago Department of Public Health for just under $5.3 million. So any questions on those? All right. Hearing none, seeing none.
Then entertain a motion to receive and file the grant award related items. Is there a motion?
So moved.
Motion's made. Is there a second? Second. Motion's made and properly seconded. Any discussion on the motion? Hearing none. All those in favor signify by saying aye.
Aye.
Opposed? The ayes have it. We're going to now move to the December financial report.
All right, so, we got, the first month of fiscal year 26, reporting here. So on an accrual basis, we finished, on target on a cash basis, favorable by $3.8 million. On the revenue side, net patient service revenue, was favorable to budget, by about 1%. Due to our payer mix being slightly better than budget, specifically commercial and Medicaid. Capitation revenue was also favorable, as was the county care membership, almost 5% greater than budget. But as you'll see later in the slides, county care coming in $15 million unfavorable to budget due to a medical loss ratio higher than budget, roughly 2%. So on the next slide, So here we're showing the combined income statement for healthcare services and the health plan. So just working through the here again, adjusted net patient service revenue was favorable for the month, $1.5 million. And then the capitation revenue was favorable by almost $12 million. So total revenue is favorable by just under $14 million. And then dropping down to the expenses, total expenses just over $15 million unfavorable, comprised mostly of the medical claims expense from the health plan. So bringing us down to a net income of just under $3.5 million. So on the next slide, you're going to see that $3.5 million broken out between healthcare services and health plan services. And as you'll see at the bottom, the healthcare side showing a net income of 19.3, and the health plan showing the net loss through the first month of just under 16 million. The waterfall report is done on a combined basis, so healthcare and health plan combined. And you'll see the drivers, capitation, the favorable drivers of capitation revenue, salaries and benefits expense, and purchase services. And then the unfavorable driver being the medical claims expense that I mentioned earlier. So from a volume point of view, a couple of things to highlight here. We did have the holiday in the month of December, along with physicians on leave and PTO. So we both Stroger and Provident, actually admissions at Stroger unfavorable to budget. Admissions at Provident favorable by 1.4%. And then observation stays at both facilities, along with the ER visits, behind budget. Surgeries at Stroger coming in 7.4% better than budget, and also about 100 cases better than a year ago. And then at Provident, surgeries coming in unfavorable to budget, but want to highlight a couple of things here. Came in better than a year ago of about 60 cases, but also want to highlight the fact that we are going forward, revise the surgery budget for Provident due to the fact that we had over budgeted cases. So we will be adjusting that number, but still committed to the same revenue targets. CCH, primary care, coming in unfavorable to budget, but just basically at the same level as a year ago, just 100 short. And then specialty care visits coming in 13% short of budget, but about 1,200 visits better than prior year. And again, we had providers on leave, on PTO, that impacted those counts. So as far as at this point, no concerns as far as the volume targets for the rest of the year at this juncture anyway. The next slide showing our operating trends over time. So the only to really point out here is in the top left-hand corner is our outpatient clinic visits, which that top red line dipping down a bit going into 2026. But again, hopeful that that line will flatten out as the year progresses. Next slide, our payer mix. As I had mentioned, the month of December, we were favorable in a couple of areas in both Medicaid and commercial payer mix, which had a favorable impact on net patient service revenue. And as you'll see here, the Medicaid at 49.1%, and the uncompensated coming in just under 22. Next slide. Revenue cycle KPIs, just a couple things to highlight here. The AR days in total and the AR greater than 90, both of those areas in green, so back in line with where we expect to be. Cash collections in yellow for the month. And it just, if you look real closely, we're effectively or very close to target, but we did have some claims that we're working with the state of Illinois, some inpatient claims that they had trouble processing. So expect to get that resolved in relatively short order. Our next slide, denials. Things overall looking good here, with the government billing denials heading in the right direction, and then our net final denials at 0.7%, well below the target of 2%. Our charitable and public program expenditures projecting 687, so effectively the 690 million that we budgeted. Again, just 1 month into the year. So the main drivers there, of course, being the top two lines, which is the charity care and bad debt. Our savings initiatives on slide 12. So starting with the revenue cycle, everything going along as expected, with the exception of the CDM annual pricing review, but despite being in yellow for this month, we don't have any long-term concerns as to whether or not we'll meet that goal. The fiscal resilience project for county care, so associated with the health plan, is $100 million between combined efforts to impact favorable impacts on revenue and favorable impacts on expenses. At the end of January, we had accomplished 3 million of that, and there's quite a few initiatives that are ongoing and so as progress is made there, we'll continue to update that number. Our vendor contract negotiations, which is the agency spend, we budgeted 40 million fewer dollars in fiscal 26 than we had in fiscal 25. And just with 1 month into the fiscal year, just too early to tell exactly where we will land with that. And then last but not least, our county care income statement, again, showing the operating loss of 15 million, so unfavorable by 10.5. But again, emphasizing that the health plan continues to be impacted by the medical loss ratio higher than budget, and is continuing to work through a variety of savings initiatives. And so I'll stop there and answer any questions you might have.
Do the savings initiatives resolve any reduction in workforce?
Yeah, there is some. You want to elaborate on things, Aaron?
Yes,
but there is some.
No. Those jobs, we're not doing layoffs or anything like that. That's not. He's asking reduction in workforce, right?
Oh.
Loss ratio, right?
No,
Workforce.
No. Joe.
You're asking about workforce reductions.
Yeah, Joe's asking about a reduction in workforce as part of the savings. So
yeah, no layoffs.
The answer is no layoffs. The only reduction in workforce has gone through agency conversion. We've lost agency, but we recaptured probably most of that. So I would say probably overall our workforce is static or increasing, so we're not reducing costs based on labor cost, the reduction of labor force, though there may be a premium reduction, because when you use agency, there's a
1.5.
premium on that.
It's about 1.5.
1.5. So,
The one thing we did do is freeze open positions, about 187, if I'm remembering, last year. So those remain frozen, but they were not filled. Nobody lost their job because of it.
But if we're freezing those open positions that we need,
So there were service optimizations, right? That's the other piece we've been working on. We did the belt tightening. We've also done optimization, how we use our ORs, how we schedule, how we're operating, right? That has, and a lot of these were leadership positions for the most part. They were, that were held, right? So we've been able to kind of fill in the gaps in that. So there haven't been service reductions, there haven't been layoffs.
and we always maintain, regardless of a specific freeze, we always have vacancies in the budget. Sure. So, any other questions? And speaking, thank you, Scott. And speaking of agency, we have our monthly report on our agency reduction plan being presented by Lynn Buren, our Chief Human Resources Officer, and again, Craig Williams, our Chief Operating Officer. Executive Chief Operating Officer.
Oh, thank you. Thank you, Craig Williams, Executive Chief Operating Officer. As you can see, during the month of December, we again experienced a slight decline from 725 FTEs of agencies down to 712, hovering at about 9% of our workforce, a little bit above that. We've reviewed our performance over the last year plus in this category from a high of about just under 1,400 down to the 712 number. Next slide. This slide gives you the detail by top job codes of where we've used agency. And as you can see, we continue to make strides on a monthly basis as well as program to date. For locum tenens, this utilization has increased slightly. Total locum tenens FTEs rose from 39 to 40 in FY25 to 43.82 in January 2026. While agency staffing is increasing sharply, some departments still require locum support, specialized clinical vacancies. Right now, the departments with the highest need are anesthesiology, which has gaps in CRNA, cardiac anesthesia in general. And we have a number of vacancies that are, we have an APN vacancy, a cardiac anesthesiologist vacancy, and a general anesthesiologist vacancy. In psychiatry, we've had retirements, resignation, LOAs. This is driving the need for coverage. And additionally, in addiction medicine, we have locums that are funded by the opioid settlement to support consult services. That really explains sort of our increase in locum utilization. Next, we have Mark to talk about the Hectone transition. All right.
Good afternoon, non-directors. So we're continuing to make strong progress on the.
Hey, Mark, you're really quiet.
Way up on the volume.
We're continuing to make strong progress on the transition of staff from Hectone to MEDEX to CCH. We currently have 88 people at MEDEX who've accepted offers of employment at CCH. And the onboarding is being scheduled. Majority of those 88 have already been onboarded, and we're hoping to kind of complete this journey, over the next several weeks. And it's looking like it's going to wrap up, nicely and completely in the next few weeks. Happy to take any questions.
Any questions? Hearing none, thank you. All right. Thank you, guys. Well, unless there's any other business, we've exhausted the agenda and we are adjourned.